Why are you using donations to create drugs that the NHS can't fund?
Actually, we use our donations to create the world's best research. We are researching into new drugs, new tests, new treatments, the whole spectrum of things needed to beat cancer. Now, unfortunately, some of these new developments, they are expensive. It costs a lot to run science. It costs a lot to run clinical trials. As a result, Cancer Research UK can only run clinical trials at sort of early stage. They're sort of checking that it's safe and checking that it sort of works. We need pharmaceutical companies to come in and be our partners to run the really big stage trials, the ones with thousands of people to check the drug really does work, to check it really is better than what's already out there. And that costs lots and lots of money. So because the pharmaceutical companies have spent so much money on this, they will then charge quite high prices for their drugs because they're trying to make the money back from the investment they've already made. Now, what Cancer Research UK do is we work really hard to make sure the price is as cheap as possible. If we have licensed the technology, if we've licensed the new medicines to the pharmaceutical company, we have some control there. We can really try and make sure that they get it to market as cheaply as possible. However, if it's not one of our drugs, then of course it's out of our control. So we spend a lot of money lobbying the government, lobbying the NHS, lobbying the pharmaceutical companies to try and make sure the very best drugs are as available for as many people as possible. We know the system isn't perfect, but we believe that everyone should have access to the most effective medicine for them, and that's why we spend so much effort trying to make sure that that happens.